What we need is not more medication, but more education, because the best prescription is knowledge. This is Exposé coming to you live from Lagos, Nigeria, every Monday on Instagram, YouTube, and Facebook simultaneously. I'm your regular host, Akinyemi. Don't forget, what we need is not more medication, but more education, because the best prescription is knowledge. Welcome to Exposé. This evening again is yet another wonderful time we're going to be having today. As we continue in our series on medical systems, we have in the house again today Dr. Faith Okere, and we will continue from where we left off last week. Last week we were talking about chronic degenerative diseases on the one hand, and then we were looking at the various diagnostic tools available in integrative medicine that are not being used in conventional medicine. And she mentioned live blood analysis, she mentioned thermography, and then she mentioned blood chemistry. What did you call that? Functional blood chemistry analysis, and so on and so forth, undermed, and what have you. That was where we signed off last week. Today, what we'll be doing is she will be elaborating much more on those modalities. And then we are going to progress into looking at protocols, different protocols available in integrative medicine. We look at IV nutrition, we look at ozone therapy, and many others. So we'll list them for us and tell us more about them and who they can be useful for along the way. And then we'll be looking at the preventive aspect of functional medicine, integrative medicine. One question I always ask is, I don't have to wait until I am sick before I begin to take steps or put measures in place. So in functional medicine, in integrative medicine, what is available for people like us? We don't have any acute disease, we don't have any chronic degenerative disease. By the grace of God, I'm now in my 60s and I am not on one single medication. I'm not taking any medication. Of course, I do take vitamins, minerals, and what have you. But I don't take any pharmaceutical drug whatsoever because I don't have any chronic degenerative disease that I'm dealing with. I'm neither hypertensive, nor diabetic, nor arthritic, nor whatever. But then, people like us who want to take advantage of what is available to prevent disease and to continue to enjoy robust health, what is available? If I walk into a clinic of an integrative practitioner, medical practitioner, what is available for me apart from just conventional medical checkup? What's available? Those are all the areas that we're going to be looking at today by the grace of God. Once again, you're welcome to Exposé, and this is the place where we expose not crimes or evil, but we expose things that are available that many people are not aware of that could be useful to them. And we are honored to have back on Exposé today again Dr. Faith Okere. You're welcome to Exposé. Thank you for obliging us for the second time. Right, so I'll just let you do most of the talking today. I want you to begin with the protocols available, or if you still have additional diagnostic tools that you want to talk about, you can mention them. If you are done with that, then tell us about the different protocols that are very unique to alternative medicine, not being practiced in conventional medicine, but which you have found very useful in alternative medicine as you integrate all of these things together. Right.
Thank you very much. I'm Dr. Faith Okere, Medical Director of Medics Wellness Consult Limited, Lagos, Nigeria. So I'm here to talk about some of the diagnostic equipment that we have. Like I always say, you really don't need to be sick before you start paying attention to your body.
Right.
You know, our body is like a machine. We have a car, we don't wait until the car breaks down before we check it.
Yeah.
We do our brake check, we do our gearbox, check our fuel filter, we service the vehicle.
Right.
The same thing, our human body. works like a machine. We need to be able to service it. How do we service it? Regular cleansing, detoxification, and all those things. Check up. And that's why this early diagnostic phase we talk about the live blood analysis earlier on. Because these things can pick up changes in your body earlier than what
before
conventional,
before
you even pick it up in the normal laboratory things that we have. Now let's take, for example, we have the thermogram. Thermography is a physiological test. It can be used for different applications, cardiovascular and others, but it is used for breast health. Let me take, for example, breast health. It checks the metabolism of the breast. So it's a physiological test to show you early abnormalities, even before a lump forms. Now, I tell people it's not all lumps that is cancerous, but when people see lumps, that fear and everything comes in. But this actually picks up early vascular changes. Because by the time you have a 1 centimeter lump, you already have 1 billion cancer cells there. And that is what mammography will pick, because the structural test. But thermography will pick up when you have new blood vessels already forming.
So, angiogenesis?
Yes, angiogenesis, which is one of the characteristics of the abnormalities that we see. And then when there's any form of inflammation, you see it as redness and what have you.
Like higher temperature
in
that area.
Temperature changes, because normally the breast should be cold. And the breast should be, if you're not lactating or you're not pregnant, the breast should be cold. So you see it as a bluish picture, purplish picture, no activity.
So all the glands in the body that don't like heat are usually external to the main
like the breast
of the body.
like the testes and what have you, are external. But when you start seeing in someone that is not pregnant, you're already seeing blood vessels forming, you're already seeing, especially for women that use deodorant and with whatever, breast cancer is very common in the axillary tail. You start seeing redness there. There's a lot of antiperspirant has trapped the toxins there. So you see it as inflammation. And
you have raised another red flag there.
If those things are not dealt with, they progress. Because at the end of the spectrum of chronic inflammation is cancer. And there's no how you talk about cancer that you don't talk about chronic inflammation. They work hand in hand. And the same thing with a lot of all the other diseases. Chronic inflammation is like the foundation or the baseline in which all these other diseases form. So when we do a thermography, it's better you know what your normal is. So that by the time you start having early changes, there's some people they just walk into it, nothing is wrong with them. I just want to do a thermogram. And then you're already seeing abnormalities, vessels are already forming on one side, or you're already seeing inflammation on the ankle, something is wrong. And it's easier to reverse it at that point. Because the problem we're having in today's civilized community, we're having a lot of xenoestrogens. It's there in our plastic bottles, the bisphenol A. We have it in a lot of our foods. A lot of these things have xenoestrogens, which are adding to our own body's estrogen. They're synthetic estrogens, which are adding to our own. And that's what is causing a lot of problems. We see an 8-year-old, 7-year-old girl already menstruating. So you see a lot of all these artificial estrogens that are getting to our body, are affecting our body too, and it's causing all these abnormalities. So you use things like calcium glycopyrrolate, there are some supplements that you use that can actually detoxify and convert this negative estrogen to the one that your body can actually metabolize and flush out of your system. So that's why you don't need to be sick, you don't need to have cancer before you check your thermogram. So when you know what your normal thermogram is, you cannot do it every year, every 2 years. If there's anything, you can pick up very, very fast, and then you reverse it. And then when you repeat it in the next 3 months, 6 months, you see, definitely there's a change in this. Even most of the symptoms you have, it's already gone. There was a patient I had that she's 30-something, and then the beauty of the thermogram is that because there's no radiation, there's no age range, you can start from even teenage years. So there's a patient I had that she'd been complaining of breast pain, severe pain, and she's run mammogram like 3 times, they didn't see anything, but mammogram you're not supposed to even use for less than 40. But because of the kind of pain she was having, she decided to go and they didn't pick anything. But by the time we did the thermogram, the whole chest was inflamed. The whole chest was inflamed. And so we just said, look, this is a red flag. And if you don't do something about this, it's just a matter of time, things will go haywire. And by the time we started on some supplementation, like diindomethane and indole-carbinol, and most of these cruciferous vegetables, the whole thing reversed and the breast became cool. So if you can pick up these early signs, it's very, very easy to reverse.
You've talked about thermography. I mean, I know you have a cascade of other things you want to talk about, but before we leave that alone, I want our viewers to conclude this one. Okay, let's assume that I'm a lady, I'm okay, I want to walk into your clinic and do a thermography or a thermogram, whatever. And how often should I do that? Is it an annual thing? Is it a biannual thing? Is it at what age, or is it until there are certain symptoms or feelings? Who is advised to do a thermogram? And in relation to mammography, because I personally tell people be careful with mammography because of the radiation. Because radiation causes cancer. Why would you expose your mammary glands to radiation on a regular basis? To me, that's a recipe for building or inviting cancer. Something that was not there before. In your attempt to preempt and prevent, you are actually also orchestrating. Now, for thermography, it's just a heat pattern, more or less. That's the thing we measure. It doesn't make physical contact, no physical contact. Unlike mammography that actually compresses and can burst some capsules if they exist. Now, talk to our ladies, young ladies, medium-aged ladies, older ladies. How can they take advantage of thermography, and what should they, prepare for? How often should they do it? What benefit do they derive? You've analyzed the physiological function that it checks. Tell us more so that people will know precisely what steps to take.
Yeah, like I said, for the thermography, there's no age barrier.
Okay.
And it's always better you know what your baseline is.
Okay.
So you can walk in, it depends on what the report says. Because some people think they are well, but by the time you come in, you are seeing a red flag. Right. So you have to repeat it maybe in 3 months, 6 months. It actually makes its recommendation on how often, depending on what the initial baseline is. For some, maybe they are not seeing anything. Okay, check in 1 year time. Some check in 2 years time. It depends on the age, but also depends on what is presented as there. So anybody can come in, but there are some things that we normally we have to prepare the patient before they come in for the thermography. They don't need to use deodorants and some other things. So we always prefer when you call to book an appointment, we'll give you some list of what the do's and don'ts that you avoid when you're coming in for that particular procedure. And apart from that, thermography is not only meant for breast. Like I said, you can use it to check inflammation in other places, the spine. You can use it for musculoskeletal issues. You can use it for cardiovascular, to check for any kind of inflammatory pattern, even to check if there's an impending stroke or any other thing. But for now, I limit myself more with the breast. But occasionally, I go out with what we call the full body thermography. You can use it for other things. But for now, because of the incidence of cancer, and most time when we see it, it's really advanced. It is really a pathetic situation. And these are things I tell people: cancer cannot take place in a healthy breast. So it means the breast must have been unhealthy before. So let us try to catch these things early and correct it early before it gets to that particular advanced stage. So that is why we're actually coming out with this information. I think we are just 3 that have this machine in Nigeria today, which is a very big problem.
All 3 are not in Lagos.
And then this machine, this camera has been used in Europe for over 50 years. So it's something that they are really familiar with.
I was going to come to that because in the first episode you did mention that thermography even preceded mammography. That's the machine. How come mammography became the main line and thermography was pushed to the background? Because I read that also many years ago. The thermography had actually been there all along, but somehow it was played down and mammography took over.
Well, thermography actually started with, it was like a military technology that actually came up. But you see, with advancement in medicine, and you just have to follow the money sometimes. A lot of things come up.
You are the second person saying this on camera. You are the second medical doctor saying this on camera. We also had a professor that I interviewed, a professor of medicine, who also said the same thing, and I'm wondering. Okay, go ahead.
So a lot of things happen.
Right.
But like I tell people, thank God for the internet today. There is a lot of knowledge, but we need to also be able to know the right way to go, because also you have the positive, you have the negative. And sometimes even if you go online, you hear a lot of things, say, no, this against and against. But like I said, look at who is talking against a particular thing.
That's right.
So that we don't really get it wrong.
Yeah, I always tell people that for every PhD, there is an equal and opposite PhD. And if you consult Dr. Google for your information, you will find tons and tons of for and tons of against. Okay, and now you have to look at when you read about something that is for and something that is against. The next thing to do is to investigate who is saying it, who is behind that piece of information. Because some people mischievously throw out information on the cyber highway for people to mislead people, to deceive people, to confuse people. So you have to verify your source. whatever it is that you are finding out online. It has to come from a credible source. Yeah.
And also I would like to say thermography is not diagnostic for cancer, so people should not quote me wrong. But it's a pointer to show you
for further investigation.
Yes, for further investigation, because the gold standard when it comes to diagnosis of cancer is the biopsy.
Right.
That is the gold
when they do
standard.
the histology of
yes,
this
but we also know the
preceding signs.
The risk
of that. Yeah. When you burst the capsule, you actually make it spread faster.
So it's always better you just go for an excision than to go poking it.
Yeah, you brought that up. I actually did a newsletter number 27. I write Healthy Living newsletter. We have 27 editions to date, and the last of the editions to date is edition number 27, Healthy Living newsletter number 27 with Tony Akinyemi. And I dedicated that to breast health. And I think one of the things I mentioned there is when tumors, particularly hard tumors, when they form in tissues and glands, they usually are encapsulated. They are in a capsule. And when they do fine needle aspiration cytology, what they do is they break the capsule and take a little sample and leave the rest there. And they have already created a doorway for cancerous cells to begin to escape and invade neighboring tissues. And cancer has one of those characteristics. It invades, and within a space of a few weeks, you see the thing spreading. And instead of a complete lumpectomy to take out the entire lump, so that you can do your histology with the specimen, and if it is found to be malignant, then other steps are now taken to correct the terrain, as well as deal with whatever more activity needs to be done. Now, you mentioned something else that triggered another question, and that is the idea of antiperspirants and blah, 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 blah. Again, I have been speaking about this for long, and I tell people that when it comes to cosmetics, whether it's something I put on my hair, or my skin, or my eyes, or under my anywhere, I look at the list of ingredients. If I cannot pronounce the names, I won't use it. If I don't see shea butter, coconut oil, if I cannot eat it, I will not put it on my skin, because whatever we put on the skin being the largest organ, the body, whatever we put on the skin finds its way into the body at the end of the day. So if you can't eat it, don't wear it. Don't put it on as cosmetic. That's what I mean by wearing. So would you like to talk about that? How does antiperspirant in particular? Because I think when we perspire, we actually detox it.
Yes.
So why would we want to block that? Maybe when we come back from this short break, you will elaborate on that. Don't go away, we're going to be back very shortly.
My name is Mrs. Damilola Olabimayowa. I am here to share my testimony about how I got recovered from given a death sentence to living days, months, and years after. Before last year, I've been falling sick previously, and in and out of different hospitals. So later on, I was advised to go for a progressive test, which I did. And when I got there, they gave me the shocking news of my life, which was a death sentence, and I have just few days to live. The sickness are chronic hypertension, obesity, migraine, my kidney had a little problem. In fact, on that list was a whole lot I can't start explaining. That is what exactly brought me to this place to do the full training of the Module 1 and everything that is to take me to know everything I need to know to details about this healthy living.
Welcome back. This is Exposé, brought to you by the Shepherd's Flock International Church. I am your regular host, Tony Akinyemi, and our guest in the house today is Dr. Faith Okere, and she practices integrative medicine. She studied medicine and surgery from the University of Maiduguri in Nigeria, and thereafter got trained and acquired experience in various other modalities. Today, she has an integrative clinic that she runs in Lagos, Nigeria. She will mention the name of the clinic, tell us the address, and give us the telephone contact. Thereafter, she will answer my question on cosmetics, particularly when it comes to antiperspirants. Over Over to you, madam.
Thank you very much once again. The body is actually meant to sweat. That's the way God has designed it. And by sweating, you're actually releasing a lot of toxins out.
Right.
So with civilization, we are trying to block what God had actually initially designed to help you. It doesn't make sense. So we actually, antiperspirants are actually wrong. You could use some form of natural deodorant.
Just to smell nice.
Just to smell nice, but allow the body to be able to do what it needs to be able to do. Because the lymph nodes in your armpit, in the other areas, they are there for a purpose. So allow it to function. It's just like when you have a pipe and you block the end of a pipe, what happens? There's a build-up, and that is what happens. So by the time we are blocking things, there's a build-up of toxins in our body.
And somebody said, sorry for cutting it short, said that most toxins are stored in adipose tissue.
Yes.
And the breast is made up essentially of fat. So that's a warehouse. And that's the closest warehouse to the armpit. So you seal up that place, it just warehouses it for you. Go ahead, madam.
And that's why a lot of cancers take place first from the axillary tail.
Okay. The connection is made.
So actually, if you have to use some of these deodorants, let it be aluminium free, because aluminium too has been linked to cancer.
And many other neurological disorders.
A lot. Alzheimer's, a lot of things. And then most of all these chemicals are actually xenoestrogens, like we talked about. So the body is absorbing and it's causing more problems. So go for aluminium free. You have a lot of natural deodorants with aloe vera and some of these other things, ozone, which is very healthy. But don't try to block nature's path, because you suffer the consequences.
Right. Thank you. You've talked about one of the modalities right now, which is live blood analysis. We've talked about thermography. Okay, now would you like to talk about the other protocols? IV nutrition, RIFE machine, biophotonic, or what do you call that one?
Biophotonic.
Okay, go ahead and
okay, there are lots of protocols that are actually used in integrative medicine to deal with chronic degenerative disease. We've talked about the ozone. Ozone has different modalities. Ozone is medical ozone is like a 3-singlet oxygen molecule, and it's unstable. Once it gets into the body, that's extra oxygen.
And then recombines
as your oxygen, and then that one is able to neutralize most of the free radicals and things that get into the body. So by the time it's into the body, it actually helps to improve your oxygen consumption. It actually helps to boost your immune system because it has an immune modulatory action, and it also helps the blood vessels to actually dilate. So ozone has over 100 uses that in the body that's different pathologies that can benefit from ozone. If your immune system is high, it brings it down. If your immune system is low, it takes it up. So for viral ailments, for degenerative things, hypertension, diabetes, cancer, autoimmune, name it, ozone has a part to play. And there are different modalities. You have the ozonated saline, you have the direct intravenous, you have the bagging for chronic wounds like diabetes, gangrene, and what. And you find out that these wounds start healing instead of amputating. There are a lot of things that you can actually do with bagging. And then the insufflation, vaginal and rectal insufflation for pelvic infections and
the ear as well.
Ear insufflation, and then drinking the water. So it's a wide protocol. Broad application. Then we look at the ultraviolet blood radiation, which is also called biophotonic therapy, for a lot of applications too. Like it's act like an auto vaccine.
Okay.
Because the ultraviolet light, we have the UVA, UVB, UVC. They actually inactivate, like viruses, and inactivate it, send it back into your body, boost your immune system to be able to fight that particular thing. So it's antimicrobial, antiparasite, antibacterial. It also helps to modulate the immune system. So for autoimmunity, those that are high, it brings it down, and for those that are low, it brings it up. So it actually has a lot of, and even for patients that have issues with different applications, it's actually really wide. And there's something we call the O3 UVBI. We actually combine the ozone and ultraviolet blood radiation, and we found out that they have a synergistic action. And we get more, the action is actually potentiated, so we get more benefits with that. And RIFE has to do with frequencies. It's a frequency generator. Dr. RIFE actually found out that there are a lot of frequencies that are associated with different parasites and bacteria. And once that frequency is imputed into the body, it has the ability to inactivate and destabilize that particular microorganism. And so it has a lot of applications, medical application for diseases. It doesn't matter what it is. Now, when we look at one of the chronic degenerative issues we are facing today, which is cancer, I tell people cancer itself is not the enemy. Your terrain is the enemy. Your lifestyle is the enemy. So we should stop attacking cancer as if it's the enemy. We need to sit back. You have a cancer diagnosis. It's not the time for you to, start shouting. Cancer does not. It's not a death sentence. Basically, I always tell patients that.
That's similar to. I tell them cancer is just a word. It is not a sentence, and certainly not a death sentence.
Yes, it is not a death sentence, and you have time. Because if you look at it, it took like 8 to 10 years for the thing to actually form. So when you get a diagnosis, don't panic. Sit down. Analyze yourself. Why did I get this? Sit back. Is there any lifestyle thing I was doing? There was a man that was giving a testimony. He said, God blessed me with cancer. People felt the guy was crazy. Yes. He said,
because it was the turning point.
It was a turning point.
The life changer.
Yes. He said when he got the diagnosis, he was shocked. He was a big time CEO running here and there. Didn't even have family time, didn't have most of all these things. And when he got that diagnosis, as if the world just collapsed on him. So he sat down. First he had to resign. Next he decided to relocate, took his family, they went, thank God he had a cooperative family, and then changed his life, started living peacefully. He was given this test, they gave him 6 months to live, like he doesn't do what they asked him to do.
Yeah.
But this man was talking 10 years after. And he was
in
remission.
Can you imagine?
He said God gave him that diagnosis so that he can reevaluate his life. A lot of us, we are living on the fast lane. We are not taking care of ourselves. We are not taking care of our body. Like I said, you can't just drive your car into any place and then put the gutter water inside and expect it to function. But a lot of us, we are not even careful of what we are eating, what we are drinking, the kind of stress around us.
Right.
So when you get a cancer diagnosis, sit down first, analyze your life. Is there something I'm doing? Commonly, we have toxicity, or we have deficiencies, or we have stress, anything that can immobilize your immune system. Because like that, everyone has cancer cells or mutated cells running around them. It's just if something can break down your immune system, that is when you have a manifestation.
Right.
So sit down and think. And then start addressing these issues one after the other. Address your nutrition. Is there any deficiencies? Solve it. Most cancer patients have low vitamin D. And which is not even checked regularly in a lot of our hospitals.
Yeah, it's now becoming mainstream because in the past,
because of COVID.
Nobody would check it.
Nobody will even know about it. But now everybody knows vitamin C because of COVID. So vitamin D, they're usually low. Iodine is usually low. Selenium is usually low. Zinc is usually low. So some of these things actually have to do with your immune system.
Critical minerals.
Which are important for your immune system.
Yeah.
And when they are not there. So secondly, we talk about toxicity. Environmental pollution, lead, aluminium, cadmium. All these things are all around us. So that's why regular detoxification is key before you start anything. Then we look at alkalization. As we said, most of these chronic diseases are based on acidic waste in our body.
Right.
So they need to alkalize your body. We have different modalities of doing that. Then when we talk about the immune function, there are a lot of things that can help to boost your immune system. So even if you opt for conventional therapy, which is the surgery, chemotherapy, radiation, you understand?
The cut, burn, and poison syndrome.
Unfortunately, that is the way we are trained. But like I tell people, once the cancer is already in your lymph node, it has left, for example, the breast, and then you cut off the breast. What happens to the one in the lymph node?
Normally,
it's already there in the circulation.
Take out those lymph nodes.
What happens to the one in circulation? Like I tell people, you have a wild horse. You have opened the door for the horse is out. You're not closing the gate. It's postmortem.
Yeah.
That's the truth. Your body, the cancer is not the problem. The lump is not the problem. The lump is like every other symptom. Right. Find out the root cause of this problem. Deal with it. The body has a way of dealing with that. Unfortunately, there was a little girl, 18, thereabout. She had cancer of the right arm. I think they amputated it in the UK. It came to the right lung. They amputated the right lung. Then less than 6 months, they came to the left lung. So I was like, okay, did any people want to remove the other one? Unfortunately, she's late now.
Oh no.
And you see, after the surgery, they are not eating. They told her eat anything.
Hey, that's
and you see a lot of their clinics. They have
cookies and
sweets and
candies.
Yes, sweets and all these things. You say they eat anything, and we found out that cancer, especially in the early stage, are glucose obligate. They feed on glucose. Once they get advanced, they feed on other sources. So which means you have to watch everything.
Right.
Right now, they're looking at metabolic pathways for cancer. And that is where the medicine is now really going into. But we have a lot of natural supplements that can also block some of these things.
Pathways.
Yes, those pathways, which is very, very important. That's like the baseline.
I mean, this conversation is just getting broader and broader and broader. I wish you can get sister and sister and sister as well. We will have to take another short break for a short message, and then we'll be back. And Dr. Faith Okere will continue her discussion, our education regarding chronic degenerative diseases and cancer in particular. Don't go away.
My name is Mrs. Damilola Ogulabimayowa. I am here to share my testimony about how I got recovered from given a death sentence to living days, months, and years after. Before last year, I've been falling sick previously, and in and out of different hospitals. So later on, I was advised to go for a progressive test, which I did. And when I got there, they gave me the shocking news of my life, which was a death sentence, and I have just few days to live. The sickness are chronic hypertension, obesity, migraine. My kidney had a little problem. In fact, on that list was a whole lot I can't start explaining. That is what exactly brought me to this place to do the full training of the Module 1 and everything that is to take me to know everything I need to know to details about this healthy living.
Welcome back. This is the last leg for today. I wish we could do part 3, but you see, I will let those who want to hear more, know more, experience more, to reach out to Dr. Faith. Probably book an appointment to see her in her clinic. She's been talking about metabolic conditions, chronic degenerative conditions, particularly cancer. And I was reading a particular book which articulated at least 33 known causes of cancer. 33 things that are contributing factors to both the initiation and the progression of cancer. And the author tried to also categorize the 33 factors into different categories. One of them he calls biological factors. For example, somebody may have HIV, and if he doesn't take care of himself very well, it can lead to Kaposi sarcoma, which means that there is a biological agent that laid the foundation that progressed into that. Or somebody may have the human papilloma virus that can lead to cervical cancer, which is a biological agent leading to a cancerous situation. And then another category comes under chemical agents. And then there are environmental agents, and he categorized them into those various categories. 33 that are known, and then there are several others that are not even known yet that can contribute. Where you have beautifully woven everything together to say, okay, let's look at everything that is contributing to this, and let's reset the template so that this environment, this terrain of this body where this cancer is growing, because the human being that has the cancer is the host. The cancer is the guest. Now, and the environment has to be conducive to sustain the life of the cancer. But your treatment and your approach is to redefine that environment, reprogram that environment to make it hostile to the tumor, to the cancer, and make it friendly to recovery and boost the effort of the body to tackle the cancer. Because the body itself doesn't rest on his words. He's making efforts. Sometimes it's just that the body is overwhelmed. Because, like an earlier professor of medicine that I interviewed said, he said the body is deranged. Okay, so take up that conversation from there and talk to us. If a person walks into your clinic with cancer, where would that person start from? That is, what do they expect when they come to your center? That's one. The second part is, maybe when you finish that, I'll talk about it. That is the idea of cost. Because sometimes people know these things are available, but they are not affordable. And it becomes an issue. We are looking at how we can look at what is available and make it affordable so that we know that whatever resources are deployed, they are not free. They have to be sourced. Sometimes in hard currency, and the exchange rate is not helping matters. Yeah, so touch on both sides. A cancer patient comes to your clinic, what should they expect? Number two, the idea of affordability. And number three, I want you to give us a case study of one anonymous person. You know that person has been your patient. The person walked in as a cancer patient. Today, that person is in remission. Maybe the person has been in remission for 5 years or beyond. Use that person without disclosing the identity to give us as a case study of somebody who has benefited with all of these modalities. Of course, I'm aware that there is no treatment plan anywhere that can guarantee 100% recovery. But we talk about success rates. If conventional medicine, surgery, chemotherapy, radiotherapy claims to have, 30% success rate in a particular cancer, if a person deploys integrative, can that percentage grow from 30 to, let's say, 60% or something like that? Those are the things I want you to do all the talking from now on with little interference from me.
Thank you very much.
Right.
Like I always say, prevention is the best cure.
Right.
It's always better to catch it early. Unfortunately, we don't get to see patients until they are advanced. And by the time they are advanced, you're stage 4, stage 3, there's really nothing much that the orthodox medicine can do for that person. Except palliative treatment. So if cases can come earlier, it will be easier to manage. An example is a lady that came to us, this was like 7 years ago, thereabout. She had a lung, stage 1. She had done a lumpectomy, but the lung kept, most times always come back. And she did not want to go through the chemotherapy and radiotherapy route. And she didn't want to cut off the breast, but we told her she had to come and cut off the breast. But she said no, she was not ready to go through that route. Okay. So we see patients that don't even want to go through the conventional.
Okay.
Like I said, the conventional is not bad. But when it gets to a stage 3, stage 4, you need some form of chemotherapy. But out there's something we call low-dose chemotherapy or metronomic low-dose. There are different types. Metronomic low-dose chemotherapy. We have low-dose chemotherapy. We have insulin potentiated chemotherapy. We have DMSO potentiated chemotherapy. Whereby a fraction of the normal dose is used, but used intelligently. And there are ways to use potentiators, so it targets the cancer cells. Okay. Because
is that available? That's available in Nigeria as well. Do you do that in your clinic? Okay, go ahead. Don't worry. Just go ahead and talk about.
So these protocols are actually available in Europe.
Okay.
They are available in Europe because
I actually have read about them. I have a big book in my library on my shelf right now on all of that. So I just wanted to be sure that people can access it.
Because you need to bring down the tumor load as fast as possible, especially when it's that advanced.
I like the way one book calls it the tumor body.
Yeah, that's the tumor body. True, that's the tumor body. Right. Natural medicine cannot bring down that body fast enough, and especially when you don't have time.
Right.
So time is always of essence. Now, this patient came in 1B. She didn't want to do routine surgery and the rest, and she said she go through integrative route with her diet, changing her lifestyle, reducing stress, doing everything that she needs to. And she's about 6-7 years in remission today. In fact, I've not even seen her in the last 2 years, because you see, the problem with our people is that once they start getting better, they feel everything is fine and they disappear. But like I always say, except God divinely removes that thing from your DNA, there is always a possibility of it coming back.
Okay.
So we've had patients that are in remission today.
For how many years?
We have another male person that has colon cancer. He's about 4 years.
4 years now.
Yes, we have another one we said they're in remission, but we are still seeing them.
Yeah, they have
for
to be
check-up
monitored.
and rest. This one is about a year plus. We have another one that is about 3 years. So there are few of them like that.
Right.
Yes, and there's another young girl, because of her age, she didn't want to do a mastectomy, and she's not married, and she's been, good for more than a year plus. Because we started seeing her last year, and she's been calm. The tumor markers are all gone. Thermography is still clear, and they are doing well, basically. And then we've had those that have actually gone through the conventional route, and then the cancer came back, and some of them are now,
typically.
Because the chemotherapy, radiotherapy does not get rid of the cancer stem cells. So it's also very important for those that have gone through these methods to also do some integrative
after the conventional
to keep the cancer stem cell at bay.
Okay.
Because there are some things that you really need that will help to put those ones to be quiet, like therapy, using curcumin, using high-dose vitamin C, which act like natural chemotherapy agents. So we have a lot of all these things that we can actually use. Then the B17 in the injection form, because cancer cells do not have the enzyme to protect them.
Yeah.
But the natural cells, healthy cells have that enzyme. And then by the time you give their B17, especially for IV, we use high dose. You can't use that high dose orally. So for IV therapy, they are able to hit the cancer cells, and you're able to get, these are part of metabolic therapy, you're able to get it under control faster. So integrative, like I said, when it comes to advanced cancer, you need both worlds. Need both worlds. And for a lot of women, we find out that when they cut off their breast, their psychotherapy becomes a problem. So as much as possible, if we can preserve the breast, they will do better. We've had some patients that they didn't need to cut off their breast, and they are fine today to the glory of God. Now, part of the metabolic therapy, we have things we call the DCA. What does DCA do? We know when it comes to cancer cells, they produce a lot of lactic acid, which also helps them in propagating the acidic environment. So DCA actually blocks one of the enzymes and helps the mitochondria to start functioning normally. Okay. So most of this therapy are non-toxic to the body. But like I said, it doesn't work for everybody. It's not 100%. Now, therapies like this in Europe cost a 3 weeks therapy. Most clinics, they do 3 weeks therapy. Costs from between $25,000 to $45,000. But here we try to do it at a fraction of a cost. The dollar is very high now, so there's nothing anybody can do about that. So it is still high. But compared to what is done over there, it is just a fraction of the cost. But like I say, like most of these people that come earlier, they don't even need all these IV therapies. They just do well on the supplement. And unfortunately, the more our environment is getting toxic with the radiation, with the phones and masks and all around us, a lot of issues are really coming up.
Microwave ovens in our kitchens.
Microwave oven, please throw it away. Our grandmothers did not use these things. Yes, because they devitalize the food. You are actually eating dead food.
And create a lot of
and then by the time you open your microwave, your body has just absorbed the radiation from there. Right. You don't need it. And even the pots that we are using to cook, your aluminium and all these things. So there's a lot of things to really talk about. But because of time, we really don't have much to really talk about. But there's a lot when it comes to cancer support. We call it cancer support. Because we're just trying to support the body. It's the body that has the ability to heal. I cannot heal anybody. Nobody can, and nobody gives any guarantee anywhere. But what we are saying is that your body can heal itself. Just change the terrain that encourages these diseases to come up, and then your body will be able to cope, will be able to deal with it. For cancer cells, you see them, they hide themselves from your immune system with the protein coat over them. There are ways you can unveil them using proteolytic enzymes, and that is one of the major things that there's a doctor called Dr. Nicholas Gonzalez.
You have eliminated him now.
Well, that's the politics of the system. But these things really work because once it's able to unveil the cancer cells and then boost your immune system can recognize these cells and go after them. The cancer cells have a way of recruiting even your own cells to be part of them. They are very, very wise. And that is why you don't use one modality when you are trying to deal with cancer.
Multi-pronged approach.
It's just like chemotherapy. After a while, they said it's no longer working. Yes, the cancer cells are very, very wise. So, but if you do a multi-approach, you find out that you are getting better results and the outcome is better. In Europe, for those that do even cases that they told them you have 2 weeks to live, not after 20 years, they are still alive. So they find out that they're getting better results when they do an integrative approach. So it doesn't matter at the stage you are in now, you can improve on that. Because unfortunately the dose of the chemo kills the immune system, and it's the immune system you need to protect your body. So when you are doing that, also augment and try to help your immune system so that they're able to fight any opportunistic viruses or anything that is coming. Right. Because they find that from a lot of all these studies that are going on, viruses and some of that, the underlying factor that causes this mutation of the cells and some other things. So basically that is what it's all about.
Well. Wish we have more time to continue. Dr. Faith appears to be very loaded and wants to really download so much. But then, if you want to learn more, of course, the platform of Exposé is to release as much as possible. We don't hoard information. We let you know what is available out there. But we have an institute, Rafa Institute of Healthy Living, in case you want to have a structured form of learning on healthy living and all of these things that our various guests have been sharing. You can just enroll. We have several modules, module 1, module 2, module 3, module 4, and so on. And they are short-term courses, 4 to 5 days max per module. But they are very, very rich in content. And we also have one-day healthy cooking classes just to help you to convert your kitchen to one of the best hospitals in the world. Because we tell people that there could be death in your pot, in your kitchen, death in your pot, and there could also be life in your pot. It all depends on what you cook, what you prepare, and what you serve your family from your kitchen. Your kitchen can become one of the best hospitals in the world, where you serve medicinal food, therapeutic and prophylactic food, geriatric food to your family members. So join us at our institute for one of these events, one of these days. Your life will not remain the same. Before we allow Dr. Kerry to go from here today, once again, we would like her to tell us about the name of her practice, her location, her contact, so that those who may want to reach out to her will be able to reach out.
Yeah, thank you very much, sir. My clinic is Medics Wellness Consult Limited, New Cover, Lagos. I'm not doing the address because it's based on appointment. Okay. But you can contact any of this number on 08055180507 or 08182796721, or send us a mail at medicswellness@gmail.com. Our site is Medics Wellness Center.
The center is American spelling. Okay.
ER.com.
Okay.
But it's undergoing some maintenance now, so it will not be active. So I think you can always send us a message on WhatsApp if you have any questions or any queries, and then we take it out from there. Thank you.
So on behalf of everyone, we'd like to say a big thank you for coming on Exposé, giving us 2 whole episodes. It's been a blessing, and I believe our viewers have benefited immensely. Once again, we also want to thank our viewers for always keeping a date with us on Exposé every Monday evening, 8 p.m. Nigerian time. Don't forget to share this with your family members and friends. And if you have not done so, please go ahead and subscribe to our YouTube channel. Also press the notification bell so that you don't miss another episode. And in fact, you can watch previous episodes on YouTube as well. And if you're watching us on Facebook, okay, just like us on Facebook. I always tell people, even if you don't like my face, please like me on Facebook. Okay? If you're watching us on Instagram, just follow us on Instagram. And you will always be blessed. 8 p.m. Nigerian time, every Monday is the time for Exposé, the platform where we reveal, where we unveil, where we inform, and bring to your notice, to your attention, things that are very beneficial to you and your family members, particularly regarding your wellness and your well-being. Don't forget, what we need is not more medication, but more education. For the best prescription is knowledge. God bless you. Thank you for your time. You have a very phenomenal evening and a wonderful week ahead. Bye-bye.
My name is Mrs. Damilola Ogulabimayowa. I am here to share my testimony about how I got recovered from given a death sentence to living days, months, and years after. Before last year, I've been falling sick previously, and in and out of different hospitals. So later on, I was advised to go for a progressive test, which I did. And when I got there, they gave me the shocking news of my life, which was a death sentence, and I have just few days to live. The sickness chronic hypertension, obesity, migraine. My kidney had a little problem. In fact, on that list was a whole lot I can't start explaining. That is what exactly brought me to this place to do the full training of the Module 1 and everything that it will take me to know everything I need to know to details about this elder living.